Culturally competent nursing care for Asian Americans. Asian Americans are people of Asian ancestry and include various ethnicities and nationalities, such as Chinese, Japanese, Korean, Hmong, Mongolian, Thai, Vietnamese, Indian, and more. When caring for an Asian American patient, ask if he or she has cultural or religious considerations to healthcare. Many Asian Americans speak English as their primary language. Some Asian Americans and Asian immigrants may speak English as a secondary language or only speak an Asian language, such as Mandarin Chinese, Cantonese Chinese, Japanese, Korean, Mongolian, and Vietnamese. Use a certified interpreter to communicate with patients who do not know English or if English is not their primary language. Various religious traditions can be found being practiced throughout the Asian American community. Hinduism is the predominant religion of the Indian subcontinent and some parts of Southeast Asia, while Buddhism is the predominant religion of East Asia. Confucianism and Taoism play major roles in Chinese culture, while Shinto plays a major role in Japanese culture. Many Asian Americans also practice Christianity and Islam. Most Asian Americans follow the holistic health model of understanding health and illness. According to the holistic model, an individual is composed of the individual's body, mind, social life, and spiritual life. An illness is the result of imbalance of the patient's physical, mental, social, and spiritual needs. However, Asian Americans also follow the biomedical health model, which is based upon modern Western medicine. The Eastern traditions of Asia are based upon philosophical thoughts of Chinese and Indian philosophers and the religious traditions of Confucianism, Taoism, Hinduism, and Buddhism. There are several cultural-bound syndromes that can be observed in the mental health of the Asian American community. Examples of Asian culture-bound syndromes include Hua Biang, a Korean culture-bound syndrome closely related to depression that is characterized by epigastric pain, anorexia, palpitations, dyspnea, and muscle pain, and is believed to be caused by a lack of harmony in the body or interpersonal relationships. Koru, a Chinese culture-bound syndrome that is characterized by the irrational fear of having a shrinking penis, and wind illness, a Vietnamese culture-bound syndrome characterized by the fear of coldness and wind, and is treated by keeping warm and avoiding cold foods and drinks. Key elements of Asian American culture include having an extended and multi-generational family, interdependence and collectivism, filial piety, and respecting the elderly and one's dead ancestors. Public expression of emotions is discouraged in many Asian cultures, and many Asian cultures value restraint when talking about one's issues. These can cause some nurses difficulty when assessing pain or the mental health of some Asian American patients. Many Asian Americans may follow a traditional healing tradition, such as traditional Chinese medicine and Ayurveda. Traditional Chinese medicine is a school of healing traditions that emerged in ancient China approximately 3,500 years ago, and is based upon the idea of manipulating qi, the body's vital energy. According to traditional Chinese medicine, disease is caused by an imbalance or interruption in the flow of qi. Methods of healing used by traditional Chinese medicine practitioners include acupuncture, acupressure, cupping, coining, massage therapy, qigong, tai chi, heat therapy, herbal medicine, and prescription diets. Ayurveda is a school of healing traditions that emerged in ancient India approximately 2,500 years ago, and is based upon the view that illness is the result of imbalance among the body's systems, and teaches that humans are made up of the body, the mind, the spirit, the social life, and the environment. Methods of healing used by Ayurveda practitioners include prescribed diets, herbal medicine, yoga, and prescribed exercise regimens. Ask the patient if he or she uses herbal remedies and traditional healing methods to determine possible drug contraindications. Clinical studies have shown that blood pressure levels in Asian Americans can be too quickly lowered by ACE inhibitors, a class of antihypertensive drugs such as lisinopril. Clinical studies have also revealed that Asian Americans require lower levels of antidepressants to adequately treat depression. Diseases and psychological disorders common among Asian Americans include glaucoma, diabetes mellitus, COPD, cardiovascular disease, osteoporosis, anxiety disorders, and depression. Avoid using Asian American stereotypes, such as all Asian Americans are great at academic studies, or that they know how to perform martial arts.